Hello everyone. Hope you all are fine. Let's learn about hemostasis. Hemostasis is made up of two words, hemo and stasis. Hemo means blood, whereas stasis means cessation or stoppage. So, hemostasis is stop or rest cessation of the bleeding from blood vessel. Hemostasis is initiated due to injury to the blood vessel and damage of endothelium. Now, Hemostasis is achieved by three processes. Achieved by three processes. First process is called as vasoconstriction. Vasoconstriction. Second process is called as platelet block formation. Third stage or third process is called as coagulation. Coagulation of blood. Now, these hemostasis are of two type of hemostasis. One is primary, whereas next is secondary. Primary hemostasis, platelets plays the major role. In primary hemostasis. Whereas in secondary hemostasis, clotting factor or coagulation of the blood plays the major role. Both of these platelet and clotting factor are present in our blood. Both of these platelet and clotting factor are present in our blood. So, let's discuss about the component of the blood. Let's discuss about the component of the blood before discussing about the hemostasis, a type of hemostasis. So, blood component. Component of the blood, major component are plasma and cell. 55% of the plasma, whereas 45% of the cell. And RBC, WBC and platelets are present in cell, whereas clotting factor are present in plasma. 44% out of 45%, 44% of RBC are present in our cell, whereas 1% of WBC and platelet are present in our cell. Therefore, cell is also called as a therefore WBC and platelet are also called as buffy coat. Buffy coat. Okay, hope you all are understanding what I am saying. Now, clotting factor. Clotting factor, much protein is present in clotting factor. It is also a type of protein. So, this clotting factor plays major role in secondary hemostasis, whereas this platelet play major role in primary hemostasis, as we have discussed about it before. Now, let's discuss about primary hemostasis, how the primary hemostasis is achieved. Discuss about primary hemostasis. Primary hemostasis is a process initiated after the injury to the vessel, resulting in formation of platelet plug. It is achieved by vasoconstriction, platelet adhesion, platelet activation and platelet aggregation. Now, let's discuss in the rough diagram of blood vessel. After the injury to the blood vessel, the collagen present in the wall of the blood vessel, get exposed. This exposed collagen produce von Willebrand factor. This bone Willebrand factor act as a bridge between platelet and collagen. Hence, the platelet get attached to the collagen and gets activated. Then this activated platelet release. This activated platelet release serotonin, ADP, thromboxane. This serotonin act as a serotonin cause vasoconstriction, which reduce the injury area, hence decrease the bleeding. Whereas ADP and thromboxane act on the receptor. These act on the receptor present in the surface of another platelet, which cause attachment between the platelet and result in platelet aggregation. These act in another platelet, on the platelet, hence platelet aggregation occur. The end result of multiple platelet aggregation is formation of platelet plug, where the primary hemostasis end and secondary hemostasis begin. The platelet plug act like a weak and soluble barrier in injury site, which cannot completely stop the leakage of the blood from the injury site. So, secondary hemostasis is needed. Secondary hemostasis is needed where fibrin are produced to make the barrier strong and insoluble. Thank you. Now let's describe the primary hemostasis in short. Injury to the blood vessels. After the injury to the blood vessels, the collagen get exposed. The exposed collagen produce one Willebrand factor, which act as a bridge between platelet and collagen. Then the adherence of the platelet to the collagen, which cause the activation of the platelet. After the platelet get activated, it secrete the serotonin, ADP and thromboxane, and even formation of the prothrombin activator. Now, after the secretion of the serotonin, it causes vasoconstriction, which helps to reduce the injury area, hence decrease the bleeding. Whereas secretion of the ADP and thromboxane cause aggregation of the platelets, which result in platelet plug formation, as we have discussed before. Now, formation of the prothrombin activator cause blood clot. Thank you.